Hello, I'm Dr. Rengi. I'm an endocrinologist and I practice in Sacramento. Want to discuss an important topic today that we see in our practice, and this is related to thyroid. The condition we're talking about today is called hyperthyroidism. Thyroid is a small gland which is present in the lower part of the neck, right here, and it makes hormones that are very important for our body. Sometimes the hormonal function gets dysregulated or goes at an unregulated rate, and that gives our body too much thyroid than what we need. Thyroid makes hormones called thyroxine or T3 and T4, and those hormones are always in a well regulated fashion, regulated by a hormone from the pituitary gland called TSH or thyroid stimulating hormone. And thyroid stimulating hormone in the pituitary is regulated by another hormone in hypothalamus called thyrotropin releasing hormone. So it's a very intricate cycle, which is always kept in a very good balance. And if that balance is distorted for any reason, and if the thyroid is making too much thyroid at an unregulated rate, which is not working with the feedback mechanism, that is a condition called hyperthyroidism. Now the question is, when you have too much thyroid, how does it matter? Why do we care? We care because it makes us sick. Most people do feel sick with some symptoms, and some people don't feel sick because their thyroid hormone may be working slightly more than usual and not extremely high. So I always tell patients hyperthyroidism is a spectrum of condition, and you may be on any part of that spectrum. And if you're on a very subtle hyperthyroidism, you may not have any symptoms at that point. But if you are at a more severe hyperthyroidism, you may have some symptoms of too much thyroid. Now, there's a condition called subclinical hyperthyroidism. Subclinical hyperthyroidism is a condition where your thyroid hormone T3 and T4 levels are normal, but your TSH level is suppressed. The question comes in, do we really care? Do we need to worry about it? Yes, we do, because if we don't take care of it, it can over time lead to complications that could have been prevented, especially complications in regards to heart. It can lead to increased risk of arrhythmias or irregular heartbeat, and it can also lead to increased risk of bone loss and high risk of fractures. So in some cases, subclinical hyperthyroidism improves on its own, by itself, and you don't need to treat it. So that is called spontaneous resolution of the symptoms. In that case too, you want to make sure the blood test is done over time and we can see the test has normalized before we can let the patient not follow up. Now, what kind of symptoms do you expect when somebody has hyperthyroidism? The typical symptoms are as if somebody's on a speed. Okay, so you will have racy thoughts, you may have little irritability, you may have little quick emotions, getting agitated easily, irritable, difficulty in focusing. If it's related to the heart, then you may have heart racing, palpitations. People may start feeling skipping beats, also get quickly tired. Some people do go into atrial fibrillation or arrhythmias. In regards to the gut, you have hypermotility, and that can lead to diarrhea or bloating or symptoms of indigestion. In regards to your muscles and nerves, you always feel they're achy and you have easy tremors. So those are the typical symptoms. There's also a symptom that people talk about and are always afraid of that is related to the eyes. Eyes can have appearance of slight prominent eyes or bulging eyes, or you can have double vision. Some people just have grittiness. Those are the symptoms of eye disease related to Graves' disease. Now, what is Graves' disease? Graves' disease is one of the types of hyperthyroidism, and it occurs most common. It's the most common cause of hyperthyroidism and occurs in about 70% of the cases of overactive thyroid. Now, what are the rest cases of hyperthyroidism? Those could be related to toxic nodular goiter, when you have a thyroid that has nodules or swellings, small tiny swellings that can grow over time and start making too much thyroid hormone, or somebody could have a presentation of a condition called thyroiditis. Thyroiditis is a condition where it's not that you have unregulated formation of too much thyroid, but you have sudden release of all the formed thyroid hormone that leads to sudden increase in thyroid hormone level in your system, and over time, once that release stops, you can have sudden hypothyroidism followed by euthyroidism. So there's little phases of thyroid changes that happen with thyroiditis. So those are the usual typical causes of hyperthyroidism. How do we diagnose a condition? With a very simple blood test. Normally you see in a typical finding, you have a high T3 and high T4 and a low TSH. We never check TRH in normal hyperthyroidism patients. In occasional cases, you have a normal T3 and T4, and you may still notice that TSH is suppressed. So that is the condition called subclinical hyperthyroidism. And if the blood tests are adequate, then we can start the treatment at that time. But in some cases, we also do a test called thyroid uptake and scan. And that is a nuclear study that tells us if the whole thyroid is working too much, or if there's spots on the thyroid that may be working too much. There's another blood test that we do called thyroid receptor antibodies, or thyroid stimulating immunoglobulins. Thyroid stimulating immunoglobulins are very specific to Graves' disease, and if they are elevated, that help us diagnose Graves' disease earlier on. There's another test called thyroid peroxidase antibodies, thyroid globulin antibodies. So different antibodies are done in different kind of thyroid conditions, and your doctors will be best to tell you what is the right antibody testing for you. Now, in regards to treatment, there are 3 treatment options available. We do either anti-thyroid medications, which stop thyroid from making too much thyroid hormone. The most common drug used is called methimazole. The other drug that we use in the United States is called propylthiouracil. The other 2 treatment options are either giving radioactive iodine ablation, in which case you get a capsule of radioactive iodine that is taken up by the thyroid and that destroys or shrinks the thyroid cells from making too much. Or the other treatment is surgery, where you have to see a surgeon and you have to get the thyroid out. Now, we save surgery as a last resort. Unless you absolutely need it, we don't send you to a surgeon. Some people have a huge goiter where they have a big gland that is causing them difficulty swallowing or breathing or choking sensation, and in that case, surgery is the best choice. But usually we try to avoid surgery if it can be done. There's some medication complications that you have to be aware of. Antithyroid medications like methimazole can cause, most common side effect is allergic reaction or itching or a rash, which occurs in about 5% of the cases. The other complications include you can have agranulocytosis or suppression of the white blood cells that help you fight infections. That is much rare. 1 in 500 can get it. Therefore, we monitor the levels of white count as we treat patients. There's also risk of hepatotoxicity or liver failure in certain people, especially when pregnant. So we monitor the liver function as well. It's not common at all, and that usually the benefits outweigh the risk when we choose this medication treatment for you. So hopefully this was educational. I tried to cover a lot, but there's certainly things that are very pertinent to your case that need to be discussed with your doctor. So make sure you get the right care, and we will be happy to see any patients if they're interested. 530-677-0700. Thank you so much.